Hi everyone, I'm Dr. Lynn Wagner. Today we're not only talking about hair loss, but the types of hair loss that are out there. Because if you don't know what type of hair loss you're experiencing, it's hard to know what your next steps should be. So I'm going to start with the most rare one, and that is called Alopecia Areata. And that is an autoimmune condition. Autoimmune means body attacking self. So your immune system gets confused and starts to attack your own tissue. Specifically in the case of this disease, it's attacking your hair follicles, which causes the hair loss. So with this type of hair loss, you're going to experience more patchy bald spots than a generalized thinning and shedding of hair. It's good to get it diagnosed formally by a dermatologist. And then if you're trying to manage it, it's really important to start managing it early because there are so many things that you can do when someone has an autoimmune condition, especially if you're working with an integrative provider. But like I said, that's the most rare one. So if you're experiencing hair loss, it's probably not the type that you have. The second one I want to talk about is female patterned hair loss. It's called androgenic alopecia. That's going to happen in about 40% of women. It commonly happens around shifts of hormones, specifically menopause. I can't tell you how many women come to me when they're menopausal or perimenopausal, and they're like, oh, my ponytail is 50% of what it used to be. I'm losing all this hair. So it's really, really common. Stress plays a role, hormones play a role, nutrition plays a role, and genetics play a role as well, because any type of hair loss that's hormonal is going to be related to a hormone called DHT. And again, this is something that we can do things about. So if it starts happening, you want to catch it early so that we can prevent more hair from falling out and potentially regrow your hair. And then similarly in men, you have male pattern hair loss. So that's going to be also due to the hormone DHT. This happens in up to 80% of men, so it's really, really common. We all have those men in our family who start to have that receding hairline in their late teens, early 20s, so it's very common. It is something that you can do something about if you catch it early. So you don't want to get to that point where you have to have a hair transplant. If you catch it early, there are things you can do topically, orally, when you're working with a doctor who knows what they're doing to help you prevent that hair from falling out. And then the last one I want to talk about is telogen effluvium, hard one to pronounce. That one is related to stress. And in my profession, I see this one all of the time because I'm taking care of patients who have had COVID or long haul COVID, who have Lyme disease, who are going through intense emotional stressful episodes. So it's going to happen whenever you have intense times of stress. Even rapid weight loss would be an example of this. So as that stress is happening, people are going to have either patchy loss of hair or they're going to have diffuse shedding of hair. The good thing about this one is as long as you get through the stress and you get back to a state of balance or homeostasis, that hair is going to grow back. So while it's distressing as it's happening, that one is the easiest to have the hair grow back as long as you get out of that stressful state. So with that being said, I hope that helped you understand the types of hair loss that are out there. And if you're experiencing hair loss as well, that you can try to identify what type that you have. And as I say over and over again, hair loss isn't just about your scalp. It is about what's going on inside of your body. It's about your nutrition. It's about your hormones. It's about your thyroid function, your immune system. So if you're experiencing this, it's really important that you work with an integrative provider who knows what they're doing and can look at the whole picture so you can either prevent that hair from falling out or regrow it if that's possible for you. Thanks for listening, and we'll talk soon.